Welcome, Dr. Sharma, to another session on mental health.
Well, good to be back with you, Dr. Vasconcelos.
Doc, today is August 21st, 2020, and as we continue our series on mental health, as we look at the biological nature of mental health, what are psychotic disorders?
Psychotic disorders are actually a group of disorders, so it's not one condition alone, but they all have a common characteristic of the person being out of touch with reality. So there's a breakdown, as many people call these persons correctly. They do have a breakdown, a nervous breakdown, and they act in a very inappropriate way many times. It's unfortunately that condition, the group of disorders that we call psychoses or psychotic disorders, responsible for the negative image that we have of mental health disorders. Because people don't understand what it's all about. They see the behavior as the problem, and they don't see what's behind the behavioral problem. Something has had to happen for that person who was previously functioning well to become very bizarre or not able to control their behavior. So we don't see that side of it. We see the behavior, which may be bizarre. It may make people look at a person and laugh at them because they're acting really strange, or they're undressing in public, and it becomes a sort of time for amusement, for the public amusement, when they see somebody who is previously well put together behaving in this fashion. And so that's what happened with psychotic illnesses. It's the condition that has led to much negativity about psychiatric disorders, a lack of understanding, as I said, about the true nature of the condition. And it goes back way in time where, say, from the 1840s, where the first diagnosis of psychosis was made based on behavioral dysfunction, where what was correctly recognized as a break from reality. People experiencing very strange thought processes, delusions where they feel that people are out to harm them without any validity to that, among other strange thought problems. They are experiencing disorders of their senses where they can have distortion of perception. They feel like people are talking about them. They may feel that people are talking to them, that they don't see or hear voices or see visions. Many of these things actually people experience when they're dreaming, and we don't see it as abnormal. Dreams are in a way quite strange if you think about it. The brain is experiencing almost like a movie of altered reality, and the person is aware of it. They know it's a dream, and they wake up and it goes away. But for these people with psychotic disorders, that dream seems to persist, or it manifests during the daytime and causes them to become very scared. And as such, they act out very bizarre ways. So, as I said, it's not commonly understood because it's still a throwback to those ancient ways of people thinking that psychosis is some kind of bizarre possession state. The person is under the influence of a demon, or the body is taken over and they've lost control of their ability to function because they're under the influence of evil. And this goes back to the ancient times where persons felt that this was a disorder of the mind. The word psychosis comes from a condition of the mind, psyche being the mind, or this condition of the soul, the osis being the condition, and psyche being the soul or the mind of the person. Now, in our times, in these years of 2020 going forward, we're now recognizing that psychoses are truly a dysfunction of the brain where the person has a break from reality. As I mentioned, it's sort of altered reality where they're experiencing a dreamlike state whilst they're awake, and they're out of touch with reality, so you're not responsible for their behavior. You know, people think that, well, they should be able to control themselves. Or many a time people are shouting, oh, control yourself, stop that, behave better. But they actually end up having to be treated, and they do often resist treatment, and that creates a lot of agitation, both in the persons who are trying to help them and for them themselves who are seeing the persons who are helping them as trying to harm them. Very unfortunate state of affairs. Some of the big conditions that form psychotic disorders is this condition called schizophrenia, which is another name that doesn't make sense in this modern time. In the old days, yes, it made sense to people. You can call it schism, which is a splitting of the mind, the freeness, a split mind, but that doesn't make sense now in our modern times. And I'm hoping that as we move forward and they're changing nomenclature, this will also change to the true nature of what a psychotic illness is, which is it's a dysfunction of the brain. And the brain loses control because there's either too much neurochemicals that are going to one center of the brain and causing it to become very disturbed, or there's something in the person's genes that is causing the neurochemical to become disturbed, or it's something that has happened medically in their life. For example, they may have had some brain trauma or a tumor or some metabolic problem, or even things like drugs and drug abuse can cause people to go into psychotic states. So there are many, many causes for psychotic breakdown. But the big one, as we know, it is schizophrenia, which is really a genetic disorder which runs through families, And on the sad side to this illness is that it's led to a lot of negativity, negative perception, a big stigma against persons with mental health disorders. And it's unfortunate because psychotic disorder like schizophrenia comprises of 1% of a population compared to anxiety disorders and depressions, which are much, much more prevalent. But persons don't like to be associated with the name mental health problems or persons who have psychotic illnesses because they don't want to be seen as having that kind of problem. They look down at it, they look down at these persons. Whereas treatment is relatively simple in the sense that most of these patients would need treatment by medication, which improves their brain chemistry, which is often the problem. And they return to normalcy.
Doc, what causes a person to become psychotic?
So we have two big causes. One, it could be primary, where in the brain itself, there's a tendency for the brain to go dysfunctional because of the genetic makeup. So there are precursor genes that can lead to problems which we may be carrying. We may be carrying some of these genes, for example, older persons with genetic disorder called Huntington psychosis, which causes very unfortunate psychosis when the person is in the 40s. So that unfolding of the genes happen at that age. In this case of schizophrenia, when there's a primary psychotic illness, we see the unfolding occurring in adolescence, which is also unfortunate. So there's a time that seems to make people vulnerable. For usually happens about age 16, and for girls a little bit older, age 18 to 20. So the girls do a bit better because they're more preserved. So we're dealing with the primary psychotic illnesses like schizophrenia. We see that happen in young people. We see bipolar disorders, which is a loss of control over the mood center, happening also in young adults. So those primary causes are more in the family, it's through the genes. But we have secondary causes of psychosis. So as I said before in the last interview that we had, psychosis can affect anybody. So any one of us can become psychotic if we use hallucinogens, for example, which we inject a hallucinogen, a drug, or we use PCP, or we use too much cocaine or amphetamines. Amphetamines, for example, produces a psychosis similar to what patients with schizophrenia have because it causes too much dopamine to go to the brain. So these neurochemicals, if they go out of balance in the brain, will lead to brain dysfunction. The brain can go either too emotional or experience bizarre symptoms like the delusions and hallucinations, or they can have thinking problems or thought disorder. The problem with schizophrenia, we see it as a problem of cognition. So it was way back in the 1830s where Emil Kraepelin described it, German psychiatrist described it as a dementing type of illness, a dementia. In a way, it's quite a cognition, a cognitive thinking disorder. So many causes, doc, many underlying medical causes. Drugs that we commonly use, over-the-counter drugs can sometimes induce a psychosis. Drugs like beta blockers can cause hallucination. So there are a lot of medical, physical problems that can lead to psychotic illness. Anything in the brain that disrupts the brain chemistry, neurochemistry can cause that, like a brain tumor, for example. Seizure disorders are often accompanied by psychotic symptoms. So, a lot of causes, primary causes, which are genetic, or secondary causes, which are secondary to some other condition.
Doc, are these disorders permanent?
It depends. If we look at something like schizophrenia, we're dealing with something that's similar to a person with diabetes. And patients with diabetes often would carry that for a long time. Sometimes it recovers, depends on the cause. If a diabetic state is induced by pregnancy, once the pregnancy is over, gestational diabetes, it clears up. So if a psychosis is secondary to, say, a drug that the person used, once that drug is out of the system, they start to be better, the psychosis resolves. So it depends. If it's a schizophrenic psychosis, or bipolar disorder, then that tends to be carried by that person in terms of their medical condition for a long time. It may or may not produce symptoms, but they still carry that diagnosis, you see. So if I'm diagnosed with primary diabetes type 1, which is insulin dependent, I need to be on insulin for the rest of my life, probably, you know. And the same way with a condition like schizophrenia, which is a primary psychotic illness. The person may have to be on medication, but it's not always as bad as that. Many of these patients actually can return to normalcy with treatment and may not even require medication for after a couple of years initial treatment.
So, Doc, it's fair to say with the proper treatment, many individuals with some kind of psychotic disorder can function properly.
Absolutely. In actual fact, we know that the medications that are being discovered or made, not necessarily discovered, but are being produced by these pharmaceutical companies are amazingly good compared to what was available in the 1960s. We've gone far ahead and they're very safe, very few side effects. One of the problems of drugs that were used for the brain is that they cause side effects. So it's like treating somebody with cancer. We often make them very sick. But here we're now doing much better with patients who have psychotic illnesses. Of course, if it's on a condition that's caused by another condition, for example, a medical condition like a thyroid dysfunction causing a psychosis, treat the underlying condition and then the psychosis will go away. But if it's a chronic condition like a schizophrenic illness, which is a biological genetic illness of the frontal lobe, so we get a better term for that. Even I mentioned the term we use for mental retardation is now changed to neurodevelopmental delay. I believe the term for schizophrenia should be properly called a genetic induced neurocognitive dysfunction. So it carries a much better connotation because when we use terms like he is schizophrenic, it makes people very frightened. You know, your son has a mental health problem, your son has a mental retardation, he's a mental disorder, he's psychotic. It's very upsetting to persons to carry that label around on them. They're not happy about it, you know. It passes on to even the persons who are treating these patients. Even people, the caregivers, the mental health team, they are looked down at. They're thought to be some kind of persons that are treating bizarre conditions and not medical conditions. And in reality, our patients with psychosis have a brain health disorder, brain dysfunction that is treated by treatment of the brain, and then patients do get better. So the results and the recovery rates are extremely good. So there's nothing for people to feel bad about. Of course, they feel embarrassed. You know, if nobody feels proud of running down the street half undressed or completely undressed, you know, you're not in control. But people need to view these people as we view people who have seizure disorders, persons who have no control over the brain at that time, with that same in the same light. And I think it will be a much better way forward, much better way forward in our modern times. Modern times do not need to have old, ancient, antiquated terminology old Asian antiquated way of thinking, the thoughts of people being demon possessed. We need to move away from those things. I'm not saying that there are not negative forces in this world. Some human beings behave more like demons than the demons themselves. So I'm not saying that they're not there, but we have to understand when somebody is diagnosed with a medical condition where there's significant behavioral problems, there is often a medical reason and a medical way of treating them, not soaking them in ice tubs. The amount of brutality and abuse that patients of this nature had is totally unbelievable. That human beings will do that to a fellow human being. And it still happens in many places where lack of knowledge causes patients with psychotic illnesses to be verbally, physically, emotionally abused.
Well, Doc, it is sad when people are misinformed, and education is very important. And having competent people like yourself, have worked with you last few years in Guyana with our dental medical outreach programs, and I look forward to the mental health clinic that we're working on. And I hope to see you soon. And you stay safe. And thank you very much for all you do in educating people, and especially in the context of where you are. Any final thoughts?
Yes, Doc, I see a lot of hope for change. It's a person like yourself who would come down and support our communities, education, like providing care, so that people can get knowledge. I saw change in the way of thinking of where I was in my medical school that I worked in, that students who often were not comfortable with choosing psychological medicine as a career were now very comfortable because they understood the value and importance of the brain in terms of a person's function. And I just recently conducted training at the St. Joseph Mercy Hospital in Guyana for many of our nurses, and the response was overwhelmingly positive. Where they are now advocating that we should change the term mental health, which is so worldwide used, to brain health disorders. And I was very, very happy to see that happen because we're now, well, we haven't done it, but it's a movement that I see happening. And maybe Guyana will take the lead and we'll have you in the US follow us where we can have a change of way of looking at persons with emotional, behavioral, cognitive disorders as disorders of the brain and not some kind of vague, disorder of your chin or disorder of your soul or disorder of your mind. Disorder of the soul shouldn't be coming to me for treatment, should be going to you. So, and you do a good job. So we stay in our territory, when people come to me and say, this person's demon possessed and can you treat them and make them better, doc? I said, well, come to the wrong man, gotta go to see Dr. Vasconcelos.
Absolutely, Doc. We look forward. Thank you so much. May God bless you. You stay safe, and I'll see you soon.
Look forward to that.